Okay, I see our members are coming in. If you can just tell us who you are and where you're from. Okay, for those of you who didn't see the message on the chat function, thank you for joining and please let us know who you are and where you are joining us from. Welcome, Ms. Karen from PMB and Sane also from PMB, my lovely exec committee. Hi, Dimakatso from Gauteng. Thank you for joining us. Hello, Timbalani, Mika from PMB. Nice to see all of you guys supporting us. Hi, Tia Temba. Hi, Neo. Hi, Cassie from PMB. Okay, I think we'll start then. We have some people coming in. I see, hi, Caitlin from Edgewood and Bali from Durban. Okay, we'll start then. So good evening, everyone, and thank you so much for being here with us tonight. For those of you who don't know, I'm Alia, and I'm currently serving as president for Golden Key International Honor Society for the University of KwaZulu-Natal on the Pietermaritzburg campus. Before we proceed, I just want to note that if you have any questions for our speaker, please use the Q&A function at the bottom of our screen, and they will be answered at the end during the discussion portion. So at our team building workshop at the start of the year, my committee and I knew right at the outset that we wanted to have an event that tackled the topic of mental health, and so the event was set for September. However, as the multiple challenges of 2020 unfolded, plans everywhere began to change, but I was determined to keep this event, and so here we are. The topic of mental health is still considered taboo in many cultures. There's a stigma that shrouds the topic of mental health and/or mental illness. There is also the issue of those who suffer from mental illnesses are often not met with the same sympathy that someone who is suffering from a physical ailment might receive. If you tell someone you've just received a flu diagnosis or something as small as saying you've broken a finger, you're immediately showered with sorrow and sentiment. But you tell someone you're suffering with anxiety or depression, and the first words out of their mouth are, have you tried exercising? It boosts your endorphins. And then they move on. According to the World Health Organization, there are at least 800,000 suicides recorded annually. This means that every 40 seconds, someone takes their own life. September is known as Suicide Prevention Month and serves to provide as an intervention for those who may be in silent suffering. I have lost friends to suicide. I know people who suffer from mental illnesses, and I myself am not ashamed to admit that I suffer with anxiety, and I have experienced panic attacks. Anyone who's experienced an attack can tell you about the suffocating, hopeless, and dark place that mental illness drags you to. That's why this event is so important to me, because we never know who we might help. Today, we have clinical psychologist, Ms. Nalini Raghu, who is an independent practitioner and the director of Serene Health Incorporated, which is based in Pretoria. Born and raised in Berlum, a small farming town on the north coast of KwaZulu-Natal, Ms. Raghu has always been intrigued by books and education, but from a young age. Her father created a nightly ritual where they would read from the daily news newspaper together, and it was here that her interest in psychology began. Ms. Raghu notes that she was always fascinated by the brain and human body and understanding how the mechanisms of the mind, body, and soul dealt together. However, at that time, opportunities available were limited and she struggled to gain any formal training or experience in the field. However, her fate was not prepared to fail her, as she one day spotted an advertisement for applied psychology offered through the University of Southern Queensland in the Daily News newspaper, the very same newspaper that sparked her interest in psychology to begin with. She went on to complete her undergraduate degree in psychology, and then she went on to complete her undergraduate degree, and then she began counseling at the Verulam Child and Family Welfare Center. She then went on to complete her honors degree, which she did through the University of South Africa, but she once again faced adversity while trying to gain admittance into the master's program. but she was determined and driven by her late dad's words, which echoed in her ears, which said, try and fail, but don't fail to try. In time, Hospivision accepted her into the internship and also into their master's program for clinical psychology. She keeps her therapeutic mandate, change is the law of life, close to her heart. Something that I have found particularly interesting is that the logo of Serene Health is a lotus, and this is explained by Ms. Raghu as a lotus flower still emerges pure and unblemished from the murky waters, even despite the challenges. Ladies and gentlemen, Ms. Narini Raghu will now take over. But before she does, our International Honor Society as well as UKZN, thank you for being here with us today. Special day. Thank you.
Thank you for inviting me and for having me as a guest speaker today for something as important as mental health. Thank you for the good wishes for the birthday. And it's really an honor for me to be talking to all of you this evening. I know it's a bit late, but we did decide that, and I'm sorry if I've inconvenienced any of you with the timings, but as you can see, therapy doesn't end. There's no time that therapy should end because it's always in the afternoon and people don't have an agenda of getting sick. So you have to be available basically 24 hours for them. So I would like to start my presentation. So as you can see, we're going to discuss mental health. You will see as we continue that I will be taking questions in between the presentation because I'd like it to be interactive. So if you have an opportunity and you would like to say something, please raise your hand. If you need clarity on something, I know we have a discussion section at the end, but sometimes, you know, as we go through presentations, we tend to forget things that we want to ask at that point. So, you know, feel free. I will try to address your questions. So if we can start. As you can see, Serene Health is a project of mine. We are based in Serene Street in Karsfontein, Pretoria. And you may be wondering why it says Advanced Healthcare Solutions. The reason for it being an advanced healthcare solutions is we don't focus so much on the medical field, but on the holistic field of on the holistic behavior of an individual, which is the physical, the psychological, and a little bit of the medical field as well. So if we can just go through. Is everyone able to see the screens? Do this thing on?
Now they will say something.
Okay. All right, so the aim of today's webinar, well, the aim and the objective of today's webinar will be discussed. The definition of mental health. Why is mental health important? Some frequently discussed mental conditions like depression, anxiety, bipolar, and acute stress reactions, which is very closely related to parasuicide and suicide. Suicide risk identification and the prevention model. And then I have mental health helpline numbers for the Gauteng area, but I'm sure it's quite national as well. And then we'll go on to the discussion, which is the questions and answers. Okay. So the aim of this webinar is to create awareness among students about the risk factors associated with mental illness and the referral pathways. The objective is by the end of this webinar, participants will be more informed about depression, anxiety, bipolar, and acute stress. You will understand the importance of self-awareness with regards to your health. You will understand the facts around causes, symptoms, treatment, and preventative measures for specific mental health challenges. You will have factual information on mental health risk to encourage informed decision making. Know how and where to refer peers for help or additional information on each of the mental health disorders. Okay, so what is the clinical definition of mental health? According to WHO, which is the World Health Organization, mental health is a state of well-being in which a person understands his or her own abilities. They can cope with the normal stresses of life, they can work productively and fruitfully, and are able to make a contribution to his or her community. According to Rowling, mental health is further defined as the capacity of an individual and groups to interact with each other and the environment in ways that promote effective well-being. This involves development, affective, and relational abilities. It is the achievement of individuals consistent with justice. It is also important to recognize neither nor mental health exist separately. Mental, physical, and social functioning are all interdependent, and this is in line with WHO. Okay, so let's go to the physical and mental health. So physical and mental health are the result of a complex interplay between many individual and environmental factors. This includes family history of the illness and disease or genetics, lifestyle and health behaviors, example, smoking, exercise, substance use, levels of personal and workplace stress, exposure to trauma, personal life circumstances and history, access to supports, example, timely healthcare, social support systems, or coping skills. When the demands placed on someone exceed their resources and coping abilities, their mental health will be negatively affected. Two examples of common demands are working long hours under difficult circumstances and caring for chronically ill relatives. Economic hardship, unemployment, poverty also have the potential to harm mental health. Mental illness is a recognized medically diagnosable illness that results in the significant impairment of an individual's cognitive, affective, or relational abilities. It results from biological, developmental, and or psychosocial factors and can be managed using comparable to those applied to physical disease. That is prevention, diagnosis, treatment, and rehabilitation. Okay, so why is mental health important? Mental health filters into all aspects of our life. As was earlier mentioned, cognitive. This is the ability to understand and think about simple and complex situations and act or react appropriately. Affective. The ability to feel and react on an emotional level to stimuli. This is self-awareness. Relational abilities is the ability to understand and relate to people interactionally. Mental health is about the optimal functioning of our mental, emotional, and interpersonal aspects of our being. If we are hurt in any of these domains, it filters to our physical, emotional, and interpersonal interactions, thereby disrupting optimal functioning. Can anyone at this stage maybe give me an example of dissonance within individuals that can explain how you understand this? Okay, maybe keep this question and we can answer it at the end. Okay, so the most common types of mental challenges are, as we all are familiar with, depression. So what is depression? It is a mood disorder that involves a persistent feeling of sadness and loss of interest. It is different from the mood fluctuations that people regularly experience as part of life. Major life events such as bereavement can lead to depression. However, doctors only consider feelings of grief to be part of depression if they persist. Depression is an ongoing problem, not a passing one. It consists of episodes during which symptoms last for at least 2 weeks. Depression can last for several weeks, months, or years. In people with depression, the long-term exposure to increased cortisol can slow the production of new neurons and cause the neurons in the hippocampus to shrink. Depression is an extremely complex disease. Some people experience depression during a serious medical illness. Others may have depression with life changes such as a move or the death of a loved one. Also illness. Still others have a family history of depression. Those who do may experience depression and feel overwhelmed with sadness and loneliness for no known reason. The latest scans and studies of can exert what are called neurotropic effects, meaning that they can help sustain nerve cells, prevent them from dying, and allow them to form stronger connections that withstand biological stresses. So here are some of the symptoms of depression. This is not all, and this is not the clinical DSM-5 diagnosis. It is just a shorter version that is more relational. So abuse, certain medications, conflict, grief or genetics, major life events, personal problems involving self-isolation, serious illnesses, substance abuse, childhood trauma. These are the indicators of depression. The physical, fatigue, lack of energy, weight gain or loss, substance or alcohol abuse, sleeping too much or too little, withdrawal from friends and family, self-isolation. The emotional, sadness, anger, guilt, anxiety, fluctuation in mood, irritability, aggression, demotivation, neglect of self. The psychological, forgetfulness, poor insight, lack of judgment, feelings of helplessness or worthlessness, loss of interest in work or studies, rumination of thoughts, suicidal ideation and attempts, poor self-esteem, and lack of confidence. So how do we treat depression? We can change the way we think about a situation with the help of a trained clinical or counseling psychologist, engage in meaningful long-term psychotherapy. The most important treatment for depression is to be able to find a safe, confidential space to understand one's emotions and behavior. It may be necessary to engage the services of a psychiatrist to address moderate to severe depression. Antidepressants assist in facilitating meaningful therapy. It is only a tool for managing depression. And yes, depression can be successfully treated. Okay, and then anxiety, something that a lot of university students are very familiar with. It only becomes a disorder when the following persist. Anxiety is basically a fear. It is a fear of the future, fear of the unknown, fear of not being in control of certain aspects of life, like death. It would be simplistic to say it is be afraid of something beyond our control. As humans, we have a complex history and identity that informs our fears. It is therefore necessary to become more aware of what informs our fears rather than being stuck in the cycle of helplessness. Some of the symptoms of anxiety are feelings of nervousness, restlessness, or tense, having a sense of impending danger, panic, or doom, having an increased heart rate, breathing rapidly, hyperventilation, sweating, trembling, feeling weak or tired, trouble concentrating or thinking about anything other than the present worry, having trouble sleeping, experiencing gastrointestinal problems, and rumination. So these are some of the indicators of anxiety. On a behavioral level, you'll find it's hypervigilance, irritability, or restlessness. On a cognitive level, it is lack of concentration, racing thoughts, or unwanted thoughts. Physical, fatigue, sweating, and as Aya mentioned earlier, it is that intense fear that you experience, that panic, that breathlessness of impending doom. Also common in anxiety is excessive worry or rumination, fear, feeling of impending doom, insomnia, nausea, palpitations, or trembling. So how do we treat anxiety? Cognitive or stress-producing thoughts. Psychotherapy, which is an in-depth analysis of fears and focuses on the underlying cause of the anxiety. Relaxation techniques for mild to moderate anxiety. Psychiatric prevention for moderate to severe anxiety or anxiolytic medication. In extreme cases of anxiety where rumination cannot be controlled, so that is, thoughts keep on going on and around in your mind and you find it difficult to be still. In extreme cases, then ECT or electroconvulsive shock therapy is also recommended. Okay, so what is acute stress reaction? This occurs when symptoms develop due to a particularly stressful event. It includes, but is not limited to, the loss of employment, dissolution of relationships, death, or divorce. This may develop immediately after a traumatic event, and all the above are traumatic events, and can last up to a month. Poor coping mechanisms contribute to parasuicide attempts. The stress is so intense that people find it difficult to make rational decisions and feel helpless. Their reaction often occurs from feelings of inadequacy or failure, depression or general unhappiness, anxiety and agitation, moodiness, irritability, or anger, feeling overwhelmed, loneliness and isolation, other mental or emotional health problems. The treatment for acute stress reaction is short-term behavioral therapy, sometimes medication. The reason I've put in acute stress reaction is because this is the time where we get a lot of parasuicide or suicidal ideation. And this is where people feel the world has come to an end for them, the world that they know. They feel totally helpless. And like I said, it's again poor coping mechanisms or feeling so trapped that suicide seems to be the only option out. And this very often occurs in this phase with acute stress reaction. It does not mean the person has a history of depression or they have a history of anxiety. It means that at that particular point in time, they could not find a way out. So, and this is the time where you find a lot of people say, yes, but that was a happy person, or I didn't see anything. How could this happen? Just remember that acute stress reaction is a DSM-5 disorder as well. Okay, and then bipolar disorder. This needs to be medically diagnosed. A lot of people would feel, okay, today your mood's up and tomorrow your mood's down. This is a bipolar presentation. It's really more complex than that. And I think it's a bit too intense for this platform because it needs to be medically diagnosed. Remember, diagnosis, especially on a differential level, keeps on changing. And in order to be certain that it's bipolar, because a lot of people are misdiagnosed. Every time they see by a medical professional, it's, okay, you're bipolar. It's more complex than that. There's a lot of comorbidities and everything needs to be seen, needs to be checked properly. So therefore I say bipolar disorder is not something that you can really see occurring in an individual. And it has to be medically confirmed or diagnosed. Okay, and now we come to suicide risk and prevention. Stress. Universities or college can be stressful times for young people. And it is a phase of life where many things are happening at the same time. Therefore, students are particularly at risk for suicide. Sexuality. This is a time of awakening in terms of sexuality, relationships, and self awareness. Relationships. It is a time when new relationships start and most breakups happen. Hormonal, all feelings and emotions, good and bad, are intensified and magnified. Body image is also a key factor in this phase of life. Workload and pressure to succeed. Workload is high, making friends and fitting in is stressful, and pressure to succeed can become too much to cope with. So, risk factors. These are some things to listen carefully amongst your peers. When someone is talking about wanting to kill themselves or die, looking for ways to kill themselves, talking about feeling hopelessness or helpless, meaning they have no purpose, talking about feeling trapped or experiencing immense emotional pain, talking about being a burden to others, increasing the use of substances or alcohol use, feeling of acting anxious, agitated, or reckless, sleeping too little or too much, withdrawing or feeling isolated, exhibiting intense mood swings from euphoria to depression. As you can see, these risk factors all tie in with the other mental disorders like depression, anxiety, and acute stress reaction. We have a lot of overlapping symptoms. So therefore, for me, the most serious statement is when somebody says, "I have nothing to lose." This is a very revealing statement and goes to explaining the individual's pain and apathy and their state of mind at that point. So how do we confirm the intention of suicide on a preliminary assessment? You will provide a confidential and safe space for them to navigate and explore their feelings. Once you are able to contain them adequately, you will explore further by asking directive questions. Ask the afflicted individual to describe the method they will use to commit suicide in as much detail as possible. If they are able to give you a detailed plan with method, venue, date, time, as well as a suicide note, please refer to helplines in your area, a medical professional, psychiatrist, psychologist, medical doctor on call. It is ethically your responsibility to inform parents or a support system if somebody intends to harm themselves. If the individual is only thinking about suicide, that means they are having parasuicidal thoughts. Explore in terms of narratives, and narratives mean stories. The use of storytelling or narrative allows for the individual to release pent-up pain, frustration, and despondency. And remember, talking is very therapeutic because as you're talking, you reflect on what you're saying. It also allows for the peers to provide a safe holding space for the individual and facilitates unconditional acceptance, positive regard, and no judgment. And this is very, very important. Okay, so I've just added the COVID-19 and suicide risk because this is something that is relevant in our current context. So the COVID-19 pandemic has had a serious impact on mental health functioning, and every aspect of an individual's daily function has been affected. The financial strain on households and individuals has led to feelings of increased helplessness and hopelessness. Suicide is a complex event that is a result of many potential factors, especially with the complication of COVID-19. The isolation and social distancing have created anomalies in behavior and thought processes, making vulnerable individuals more susceptible to negative thinking patterns. A key issue surrounding thoughts of suicide is intense pain that arises from feelings of hopelessness, worthlessness, isolation, discrimination, and despair. These thought patterns become problematic when the individual does not have adequate coping skills to address or change these thought patterns and breaks the cycle of negativity. So these are some of the mental health health helplines that we have in Gauteng, but I think there's some that are very much on a national level, and I would like Alia to maybe circulate and share this uh, with the team.
I will do that, definitely.
Okay. And finally, we are at the discussion. Okay, so mental health and wellness are delicate subjects. However, over the past decade, it has become more acceptable to discuss. The medical fraternity has also started to understand the relationship between psychological health and medical conditions. The shift towards a holistic understanding of the individual is being strongly advocated across the world. Psychology and psychotherapy are seen as effective tools in managing referred pain and stress-related conditions. This is a significant step in the field of healing. So we know we are moving away from the medical model of healing to a more inclusive model. Depression, acute stress, and anxiety play significant roles in managing suicidal ideation. If we take the time to really understand why we feel irritated, upset, heavy, or helpless after talking to a person afflicted by any psychological distress, we can then understand the burden of living this person is carrying alone. Our reactions, this is our gut reactions, which we often ignore, is a reflection of the difficulties people in distress experience as a reality. Don't avoid them. This is the first sign of asking for help, even if it's on a subconscious level. Assist them to seek help. Talk to them. Thank you. Okay. We can go to the questions and reflections.
Thank you, Ms. Raghu, for that wonderful talk. If anyone has any questions for Ms. Raghu, you can just unmute yourself and you can ask the question. And on the Q&A, I can already see there are already a few questions. So I'm just gonna click answer live for each, and Ms. Raghu can answer each question as she sees it. Okay. Okay, can I just read out each question so that she can get the chance to answer it? The first question for you, Ms. Raghu, is where does body dysmorphic disorder and bulimia fit in, and how can one overcome it?
Okay, so body dysmorphic disorder will fall under stigmatization. So remember when you're a young child and a lot of people will say, you don't look good, you're eating too much, you're fat. And all these things play on a child's mind. You'll find that a lot of people that are diagnosed with body dysmorphic disorder have the underlying symptoms of depression and anxiety. And remember, body dysmorphic disorder is a sign of control. So when you don't have control of something, you will tend to turn to something that you have control of, which is your eating. And that is the only thing you have control over. So for me, body dysmorphic disorder, definitely the underlying symptom is, the underlying cause of it will be depression, will be the first signs of depression. If you see one of the symptoms, it's weight loss or weight gain.
Oh, okay, thank you. And the second question is, does depression have levels of seriousness? And if not treated early, does it become worse?
Definitely. We have mild, moderate, and severe depression. Mild depression is, like I said, if you're just experiencing it on a primary level, meaning you've lost somebody and you are in a grieving process, you will experience some of the symptoms of depression. However, it's just at that stage, you just need to talk to somebody. You need to talk to a professional so that it doesn't get worse. It will get worse if untreated. It will lead to moderate and then severe. Severe is when we would recommend that you see a psychiatrist for drug management.
Okay. And the next question from Neo Kabi is what does successful treatment of depression look like?
A fully functional individual who can interact with anybody on any level, meaning you wouldn't know that this person has this illness because they are coping with it. They have the proper coping skills. They have the correct tools and mechanisms to aid them in functioning normally or as normal as possible. But they are fully functional individuals on treatment or either seeing a psychologist or a psychiatrist or both.
Okay. And the next question from anonymous attendee is, what are some of the effective ways to help a loved one who is exhibiting some of the symptoms that were mentioned if they are in denial that they are suffering from one of the mental illnesses?
I think the most important thing is it's very easy for us. Remember, immediately we say that there's a loved one experiencing something, we're judging. It's always best to listen to them, just provide a safe space for them to talk. So listen to them, understand what they are saying, and just be there for them. That is the support system. If they can, you can build a trust with them, or a trusting relationship with them. Remember, this trust is a very, very important part of a person's healing process. And if people aren't able to trust you, they will not heal. So you need to create that space for them. Once you're able to do that, then you can assess at a deeper level and say, you know what, let me show you some slides. Let's talk about this further. Do you think you are experiencing these things? But because they have established their trust with you, they will be more open to something on a deeper level.
Okay, thank you. We have another question from Nosi Pomkize. She asks, what are the correct types of food to include in our diet to help take care of our mental health, especially during the examination period?
Okay, so food should be your diet should be very simple, but also remember when we speak about diet, it's more about quantity. And I'm not going to say go on a specific diet. All I'm going to say is just make sure that whatever you're eating is sustaining you throughout the day. So it's providing you with a lot of energy. It's providing you with a lot of, it's giving you the ability to concentrate. And this would include a lot of leafy vegetables. Avoid fried stuff, avoid oily foods, but also ensure that you have a lot of butter. And I know this is odd, but butter is our vitamin D. If you're not taking a supplement, then I would suggest that you consume butter on a regular basis, not margarine, butter, because this is what gives you, helps with your depression as well. So yeah, we can stay away from the oil, but let's not overdo it and start concentrating too much on a diet. The diet should be simple. Just make sure that you're eating enough to sustain yourself. And you know your body the best.
Okay, thank you. We have another question from anonymous attendee. They ask, how can we make mental health talks more comfortable and integrate them in our households and schools?
Have the conversation. Is that what you're talking about? Having the conversation?
Yeah.
Okay. So I think it's very important that from your side, you need to speak very often from your perspective. I feel this way. So it's important to use terms like, this is how I feel today. This is what I'm experiencing. I feel drained. I feel exhausted. And by saying that, you are also telling people, you know what, I've been doing A, B, and C, but I'm not able to get out of the state, and I need help with it. So when you start the conversation, but from your side, from your perspective, what you feel and what drains you, I think that becomes more important. And it's easier to open up a conversation.
Okay, I see. Thank you. We have another question from Philip. He says that in terms of time frame, when does one start getting worried about these feelings?
As early as 2 weeks. If they persist for longer than 2 weeks, in it, and let's say this is you don't have an exam, you don't have any major life changes happening, but for 2 weeks you persistently feel a certain way, or you fill the criteria. Please, at that time, I would recommend that you at least start talking to somebody to get to make sure that it doesn't get worse. So I would say 2 weeks, although according to DSM-4, it says from 1 month to 6 months, we should be aware, we should become cognizant of it.
Oh, yeah, okay, I see. We have another question from Wendy. Her question is, what are the cheapest available modes of assistance? Do government hospitals provide psychological assistance or, yeah, that's a question.
Okay, yes, government facilities, clinics do have psychologists. They also have a lot of social workers that are ecosystemically or systemically trained to address things like depression. It's advisable to actually go to them. Most of the government facilities actually have a space where they have a 72-hour assessment period to make sure that when they do the assessment of you, that whether or not you have the illness, but you are maintained in that time.
Okay. Another question from Anonymous is, hi, I wanted to ask if it is possible to have multiple symptoms of depression, but not feel depressed.
Yes, it's very possible. And this all goes back to your self-resilience. A lot of us feel down and we feel a lot of the symptoms, but it doesn't show up as seriously as it would in a person prone to depression. And that boils down to our coping mechanisms and our resilience. So how we internalize, how we interpret, and how we analyze, and how our behavior is then modified according to that. So it is possible to have it. Just as long as you are aware of it and you are aware that, you know what, it may be undiagnosed depression, but I am coping at this point. But then you realize, okay, I know I'm not coping. So that is a fine line. You need to know yourself that well.
Okay. And the final question is, if someone is showing signs of depression but in denial, where do you start?
Okay, remember, nobody wants to admit that they're depressed, and we need to be sensitive about it, because again, like mental illness, there's a huge stigma still attached to it. So if somebody says they're depressed, the first thing a family or close member, somebody not clued up with mental health or mental illness would say is snap out of it. And this is one of the reasons that people don't want to express the symptoms of depression, because of the reaction they would encounter. But if they are in denial, what would make you say that they're in denial? Have they said something? How did they interact with you? Is it something you are picking up? Or is it an observation you've made? Start the conversation. Listen to the person's narrative. Talk to them.
Okay, thank you. Thank you again, Ms. Ragu. If there are no more questions, I think we can end here for today. Thank you again for Ms. Ragu for that wonderful presentation, and enjoy the rest of your day. Thank you.
All right, you're welcome. You muted, Alia.
Thank you for being here, and thank you everyone else for attending.
I'm muted. Oh, I'm not.